Welcome to this case presentation. It promotes the diagnostic value of Saline Infusion Sonohysterography, or SIS, and it introduces you to the concept of fly-through virtual 3D imaging. We'll start off with this parasagittal section through the uterus. Note the speckled irregular appearances of the myometrium. These subtle grayscale changes are associated with adenomyosis. The changes are much more prominent around the menstrual phase of the cycle. We introduce SMI high-quality color Doppler. It shows the vascularity within the myometrium associated with adenomyosis. We introduce our 3D sector angle, our typical 3 to 5 second sweep, and this produces our multiplanar images and our multi-sectional images. We now move on to the SIS itself. You can see the cannula with the inflated balloon. We inflate the balloon initially to obliterate any adhesions within the cavity if possible. We now reduce the balloon and we move the cannula back, injecting saline all the time. Again, our 3D sweep. And our multiplanar images. We now move the cannula back towards the internal os so we can see the complete cavity. Again, our 3D sweep. And again, our multiplanar images. A press of the button introduces our fly-through imaging. If we look at the arrow, the viewing arrow, then you can see how we can adjust the depth of view and the direction of view. We're now moving the arrow slightly to the right so we can assess the right corneal region more closely. We now move the viewing arrow to the left to look at the left corneal region and interstitial tube. We can also adjust the telescopic view, the depth, either closer or further, as you can see. This is an abnormal case showing an intramural intracavital fibroid. Further abnormal findings: A is a unicornate uterus, B is an endometrial polyp, very well delineated, and we can see the area of attachment. And in C, you can see we've lost the clarity within the cavity, and these are multiple adhesions. So in conclusions, first of all, we mustn't forget the necessity for good quality 2D and 3D TVS modality to begin with. SIS significantly increases the ability for ultrasound to interrogate the uterine cavity. It's now first-line investigation of abnormal uterine bleeding in leading units. It has a key role to play in reproductive medicine. And as you can see, fly-through introduces the concept of ultrasound hysteroscopy. Fly-through also is easy to interpret, and people can interpret the findings who are not familiar with ultrasound imaging. It has an important role to play in terms of improved clinical communication and pre-surgical planning. Thank you very much for your attention. Thank you. Bye.